Welcome to the UC San Diego Cardiovascular Institute. It's a unique institute set up within UC San Diego where we have cardiothoracic surgery and cardiovascular medicine, the two divisions, housed under a single roof, taking care of our patients. It's a fantastic place to train for future fellows. We in the Division of Cardiovascular Medicine have a long history of training leaders, academic leaders, and clinical leaders who have gone on to tremendous professional heights throughout the country and throughout the world.
As I think you're probably aware, cardiology is very much a procedural subspecialty. If you don't do procedures, you're not going to be a good cardiologist. So I think that's one of the things that UCSD has to offer more than most any program west of the Mississippi.
I chose to come to UC San Diego for Cardiovascular Diseases Fellowship for a number of reasons. Probably the biggest reason, though, is the very high acuity and complex patient population.
At the core of our education here is really the clinical experience. So we learn a ton from our patients. We see all kinds of patients, all walks of life, all different pathologies.
We have a very high volume of cardiac catheterizations. We do a large number of heart transplants. We're now the second most busy heart transplant center on the West Coast.
We see pretty much everything within general cardiology here, from advanced electrophysiology to advanced heart failure and transplant, really sick patients who require mechanical circulatory support, and the most advanced therapies that critical care cardiology can offer.
That high acuity and that very complex patient population trains a fellow to really achieve the competency in cardiovascular disease training. And so as a fellow here, I knew that I would achieve those core competencies with respect to technical skills, procedural skills, and diagnostic skills to really take care of a whole gamut of patients.
Obviously the clinical training is very, very excellent here, very rigorous, especially during the first 2 years. But also the faculty here put emphasis on research as well and really encourage the fellows to participate in a lot of research.
Everything from observational studies and epidemiologic studies with access to large amounts of patient data and patient cohorts.
We want them to do research. We don't tell them what kind of research, but we want them to be involved in the science of cardiology.
Andy and all faculty members are always involved and open to bringing on fellows to get involved with their projects.
We also have this program called Crest, which is an acronym for a program that teaches how to do clinical research. It's an option for you, particularly during your third year, to get a lot of experience in how to write a good paper, how to do statistics, how to become more than just a general cardiologist.
We have dedicated interventional and electrophysiology clinical trial centers. We have clinical trials focused on advanced heart failure and cardiac transplantation. We have a biomarker research center. We have a congenital heart disease research center. So in addition to basic and preclinical research, that we have clinical and translational research offered in the division across all spectrums of cardiovascular diseases.
The aim of our program is for us to be treated as junior faculty, and we are treated as such so that we have a collaborative relationship with the faculty and a very collegial relationship.
Starting out as a cardiology fellow is very scary because you have a lot of responsibility, but at the same time, the attendings really encourage you to ask questions and stop and pause and think.
The faculty here at UC San Diego are incredibly available and open and interested in helping fellows achieve whatever goals they have within their careers.
One of the strengths of our program is that you get to train in various facilities.
Up here in La Jolla, there's the Sulpizio Cardiovascular Center. It's beautiful, it's state-of-the-art. This is where we do most of our procedures for cardiology.
We get to see different locations, different patient populations, different systems, and different ways of practicing cardiology. Also have 2 different clinic sites.
We have a program down at Hillcrest. The fellows really run the show. They see lots of bread and butter cardiology, heart failure, heart attacks. It's a really good program.
So here at Jacobs Medical Center, we see very complex cases that involves a lot of specialty care. The other site that we do training is the VA hospital, where we serve our veteran population. So a lot of bread and butter cardiology, and it's really rewarding to serve our vets, obviously.
At UC San Diego in particular, the fellows are intimately involved with all patient care. And so this generally involves sometimes being the first signed-in provider to take care of all of the aspects of that patient care, from the admission to the discharge, and even to follow-up for several follow-up appointments.
We have a dedicated cardiac rehabilitation and wellness center, which is both for clinical care and for research. We have a world-class ablation program, both in atrial and ventricular arrhythmias. Our interventional program is one of the largest interventional programs on the West Coast, focused on complex, high-risk interventions, structural heart and congenital heart disease interventions, and endovascular interventions. As a division, we get over $20 million in extramural grant support per year. There are over 150 publications per year by the faculty and our fellows. Our faculty have been pioneers of non-invasive cardiac imaging, and our section on molecular cardiology and basic cardiovascular research collaborates with the School of Bioengineering so that we are not only discovering new basic facts and new basic concepts that affect cardiovascular diseases, but also involved in innovations of new devices and new techniques.
One of our doctors is Dr. Castellanos, who has a relationship over the border. A number of our physicians and fellows also go over the border and take care of patients there.
We've been committed as a division to train future leaders of the field, and we will continue to do that. Our fellows who come here get to train in all aspects of general cardiovascular diseases, and if they then want to subspecialize, we have all of those subspecialty fellowship programs here at UCSD as well. We're very proud of the fact that over half of the fellows who have trained here have gone on to academic medicine, and the other half have gone on to become leaders in the community at places that they practice.
They're some of the best fellows I've ever worked with. Don't tell them I said that, but they're really, really smart, and they're very good doctors, and I'm proud of all of them.
We have not only a very down-to-earth, casual, respectful culture amongst fellows and faculty, but we really have a collaborative spirit as well.
We end up being each other's support system, and I think your co-fellows end up being the most important part of the program.
We are really close from the ocean. The weather is always very, very nice. There's a great food scene in San Diego. We often went out to the beach, hung out there.
It's a great place for people with families. You can go to the mountains, go hiking.
I think that the overall goals within the department, from fellow to faculty, are all mutual, and that is to truly train people to become advanced, specialized cardiologists, and cardiologists that specialize in physician leadership as well as academic cardiology. And so with that spirit comes a mutual interest in helping one another to achieve those goals.